Hi everyone, this video is showing a level 1 neurotoxin treatment. So we are starting off by marking the patient's lateral borders of her frontalis. A little trick in order to kind of just double check your placement when you're first starting off is just to palpate that patient's temporalis, and that is where you are going to be marking your lateral border there for your frontalis injections right along that temporal fusion line. So now we are just marking for our injection points. You always want to ensure you are at least a finger breadth or so above that patient's brow. And now going in and marking our glabella as well. You can place your injection points for your glabella as well. For this particular patient, I just went ahead and marked her tails of her corrugators. And now we're going ahead and injecting her frontalis. We are using ComfortTox syringes. These are great, they're multi-beveled. It just makes the treatment a little bit more comfortable for the patient. This patient was bleeding a little bit, she typically does. And she probably will get a little bruise in that area, but bruising is completely normal with neurotoxin. I do try my best to avoid any vessels if I can see them, but sometimes you just can't visualize them as you're injecting. And now we're going in and treating our procerus. This is a deep injection, and I just go ahead and place my units with my full needle depth there. And then we're going about 3/4 of our needle here. The ComfortTox needles are 8 millimeters in length. And then for our tails, we go about half needle depth just because it does become a little bit more superficial in this area. And just going ahead and repeating that same process on the other side. I like my patient to express so I can see where that insertion point is of that muscle. And then again, just going ahead and placing my units.